All right, let's jump right in. And I'll tell you what, this is not what you see on TV. We're about to get a raw, behind-the-scenes look at the intense, unfiltered reality of a nursing student's very first day on the clinical floor. You know, this is the moment where all that textbook theory just crashes head-on into real life. And believe me, it kicks off with a warning you won't forget.
And boom, there it is. No messing around, no sugarcoating. The clinical instructor lays it out right from the start. This is the real world, and some people aren't going to be thrilled to have a student around. You've got to earn your spot. It's a test of your people skills and your resilience from the second you walk in the door.
So, the first challenge of the day, it's not even a patient. It's just this absolute tidal wave of information. Before you can even think about caring for someone, you have to survive the morning briefing. It's a total crash course where every single detail is absolutely critical.
I mean, just look at this. You can feel the pressure, right? It comes at you fast. Don't use loose paper. Yeah, that's because it looks unprofessional and you'll lose it. Room 23 has a specific patient request. You have to respect that, no questions asked. And the memorization part? That's not a friendly suggestion. The instructor is literally going to quiz you on the spot, and you can't look at your notes. This isn't about being tough for the sake of it. It's about training your brain to hold on to potentially life-saving information in an instant.
Okay, so you've survived the briefing. Now what? How do you even start? Well, there's a very specific dance you have to do. You find your spot, you politely figure out which one of the busy nurses is your preceptor, your guide for the day, and you introduce yourself with this exact phrase. It's like a password. It shows respect and lets them know you're there to learn and to help, not to get in the way.
All right, now we're getting to the heart of it. This is where the real learning happens. See, the chart tells you one story, the diagnosis, the plan, the data. But the patient, well, the patient is a person, and they have a whole story the chart can never, ever tell you.
This right here says everything you need to know. The chart says regular diet. Simple enough, right? Wrong. The patient says, nope, no eggs for me. The breakfast tray has orange juice, but she'll only drink grape. And this isn't just about picky eating. This is your first real lesson in being a patient advocate. You have to watch, you have to listen, and then you have to act on what the patient actually needs.
And this is a perfect example of thinking on your feet. Your patient can't hear you well, so what do? You adapt. You find a better way to communicate. And suddenly, a simple whiteboard is like the most important piece of medical equipment in the room. It's a powerful reminder that so much of nursing is just creative problem solving. And then you get a lesson in something you can't learn from a book: patience. The hospital's running at 100 miles an hour. There's a million things to do. But this 94-year-old patient, she eats very slowly. And you quickly learn that you can't rush her. The real skill here is learning to slow down, to be present, and to let the patient set the pace. That's what real care looks like.
Okay, let's switch gears for a second and talk about the absolute bedrock of all nursing: safety protocols. These are not suggestions. They're not guidelines. These are the hard and fast rules you absolutely cannot break, ever. There is no wiggle room here. You have to be able to read your environment in a split second, and this is a huge part of it. You'll see these stars outside a patient's room. A yellow star? That's a heads up. It means the patient had a recent fall, so be extra careful. But a red star? Whoa, that's a high alert. That patient has a history of multiple falls. It's a visual cue that everyone on the team needs to see and understand instantly. And seeing one of those stars is your cue to run through a mental checklist. Is that bed alarm on? Check. Is the bed as low as it can go? Check. And it's not just about falls. For patients who can't move much, you're thinking about pressure source. So you're using pillows to make sure their heels aren't rubbing on the bed. You're using a cradle to keep the weight of the blankets off their feet. These little things make a huge difference.
Now this is interesting because it kind of goes against what you might think. If a patient starts to lose their balance and you help them slide safely to the floor, you didn't fail. You actually prevented a serious injury from an uncontrolled fall. It's a successful intervention. But, and this is a big but, it still counts as a fall, and you have to report it immediately. It's all about total transparency to keep everyone safe.
So what happens after a fall? Even an assisted one? Just look at this timeline. It is relentless. For that first hour, you are in that room every 15 minutes doing a full neuro check, checking their pupils, their hand strength, their awareness. Then it's every 30 minutes, then every hour. This intense monitoring goes on for basically 3 straight days to make sure you catch any sign of a brain injury. It's a ton of work, but it's absolutely non-negotiable. Okay, so you're getting the hang of the clinical stuff. You know the safety rules. But there's another whole layer to this: professionalism. These are the unspoken rules for how you carry yourself. This is what separates the students from the future colleagues.
These rules sound harsh, but there's a really good reason for every single one. Wearing gloves in the hallway? That's a massive infection control no-no and can get the hospital fined. Hands in your pockets? It makes you look like you're bored and have nothing to do. And that last one, don't make the stupid mistake, is just a blunt way of saying, pay attention. We told you the rules, now it's on you to follow them.
You know, even the way you make a mistake has a right way and a wrong way. If you mess up on a paper chart, you never scribble it out. Why? Because that looks like you're trying to hide something. The proper, legal way to do it is with a single, clean line through the error, the word error, and your initials. It's transparent, it's professional, and it's the only way.
So, at the end of this crazy, chaotic day, everything starts to click into place. The final debrief with the instructor isn't just a recap of what you did. It's about pulling all these lessons together and thinking about the kind of nurse and the kind of leader you're going to be.
And a huge part of being a leader is knowing your team. I mean, really knowing what they do. Quick pop quiz. What's the difference between occupational and physical therapy? OT, occupational therapy, is all about activities of daily living, mostly upper body stuff. Think buttoning a shirt or using a fork. PT, physical therapy, is about mobility, mostly lower body, walking, getting out of a chair, into a car. Knowing who to call for what is a game changer.
And that really brings us to the final, most important lesson of the day. It all comes down to this. This whole day wasn't just about tasks. It was about learning how to be part of a team. Because pretty soon, you're not going to be the student anymore. You're going to be the leader. And you can't be a good leader until you've proven you're a good teammate first.
So when you pull it all together, the pressure, the chaos, the constant learning, you realize something really important. Nursing isn't just a checklist of things to do. It's about communication, critical thinking, empathy, and at the end of the day, it's about leadership. This first day is just step one. The real question is, are you ready for what comes next?